Welcome to the deep dive. Today, we're tackling a bit of a hidden danger for our pets, dogs, and cats specifically, lead poisoning. You might hear it called lead toxicosis.
Yes, and we're digging into a resource called Veterinary Lead Toxicosis for this.
Our mission here is really to pull out the most crucial stuff you need to know, how it happens, what to look for, and what we can actually do about it.
Exactly, and it's quite timely. While we're seeing fewer cases in dogs, thankfully, the numbers for cats are, well, holding steady, maybe even increasing a bit.
Which makes this really relevant right now. And there are some, honestly, kind of surprising things in the source material, like a potential link between socioeconomic status and lead levels in pets.
And also just how lead works on a tiny cellular level to cause these big problems is pretty fascinating and a worrying way.
Okay, let's jump right in then. What is lead toxicosis, fundamentally?
So basically, it's intoxication, poisoning, really, from lead exposure. Could be a big dose all at once or, smaller amounts over time.
And is there like a level where vets say, okay, this is definitely a problem?
Generally, yeah.
Hmm.
A blood lead level over about zero point 0.4 parts per million is considered significant, though, that can vary a little.
Then how does it actually do the damage? You mentioned the cellular level.
Right. This is the really insidious part. Lead is structurally similar to some really important minerals, divalentations like calcium and zinc.
Okay.
So it basically tricks the body. It can substitute itself for calcium or zinc in various cellular processes. Think of it like putting the wrong key in a lock. It fits, sort of, but it jams the mechanism.
Ah, so it gets in the way of normal function.
Precisely. And because calcium and zinc are vital for so many things, transporting metals, energy production, cell communication, even turning genes on and off, apoptosis, messing with that disrupts a lot.
Wow, it's not just sitting there, it's actively interfering. So
Yeah.
which body systems tend to get hit the hardest by this rogue key?
Several major ones. The gastrointestinal system often shows signs first. The source suggests it might be due to nerve damage in the gut lining, though the exact mechanism isn't totally pinned down.
Okay, the gut. What else?
The nervous system is a big target. Lead can damage the tiny blood vessels, the capillaries in the brain, and it messes with ion channels and signaling pathways that nerves need to, well, to fire properly.
That sounds serious.
It is. Then there's the kidneys. Lead tends to damage specific cells there, the proximal tubule cells, which are crucial for filtering waste products from the blood.
Kidneys, too. And you mentioned blood earlier.
Yes, the hemic and lymphatic systems, the immune system as well. Lead interferes with making hemoglobin. That's the molecule that carries oxygen in red blood cells.
Right.
It also makes red blood cells more fragile, so they break down easier. And it can cause the bone marrow to release immature red blood cells too early.
So anemia could be a sign?
It can be, yeah. And one classic, though not always seen finding, is something called basophilic stippling. Lead inhibits an enzyme needed to break down RNA remnants in red blood cells. So these little dots, these stipples, show up under the microscope.
That's quite a list of problems. It really seems to affect the whole body. Thinking about risk, are certain pets more likely to get lead poisoning?
The source material indicates yes. Historically, dogs seem to be diagnosed more often than cats, though, as we said, cat numbers are a concern.
Okay, dogs more than cats. What about age?
Age is definitely a big factor. Younger animals, especially those under a year old, are at much higher risk.
Oh, why is that?
Couple of reasons, likely. First, their bodies, particularly their digestive systems, tend to absorb lead more readily than adults. And second, their blood-brain barrier, the protective layer around the brain, isn't fully developed yet.
Ah, so more lead gets in and it can reach the brain more easily.
Exactly, making them more susceptible to those neurological signs we talked about.
Interesting. The source also mentioned something about warmer months.
It did, yeah. Higher prevalence reported in warmer seasons. The source doesn't spell out why, but we could guess.
Hmm.
Maybe pets are outdoors more, digging in contaminated soil, or maybe renovations happen more often in warmer weather.
That makes sense. More opportunity for exposure.
Possibly. And then there's the geographic and socioeconomic link.
Right. You mentioned that earlier.
Yeah, the source points to a higher frequency in areas associated with lower socioeconomic status for the owners, and particularly linked to older housing stock.
Older homes? Because of paint.
That's a huge one. Lead-based paint is much more common in older buildings, and if it's chipping, peeling, or disturbed during renovations, it creates a major hazard. Dust and chips are easily ingested.
That really drives home how our environment impacts our pets' health. So, okay, let's talk specifics. How do pets actually get exposed? Paint is one.
Paint and paint dust are definitely major culprits, especially from sanding or scraping during renovations.
Hmm?
But the list is surprisingly long.
Oh, like what else?
Well, discarded car batteries are a classic source. Linoleum flooring, especially older types, solder, plumbing materials, some lubricating compounds, putty, tar paper.
Wow, stuff you wouldn't even think of.
Right. Lead foil, golf balls, sometimes contain lead cores, lead
Okay.
fishing sinkers, drapery weights, even some leaded glass if it breaks.
It's like a minefield of potential hazards in older environments.
It can be. And another one to watch out for is improperly glazed ceramic food or water bowls. If they aren't fired correctly, lead from the glaze can leach into the pet's food or water.
Oh, that's worrying. Even their bowls.
It's a possibility, yeah. And for cats, there's a specific route, self-grooming.
Ah, you mentioned that. How does that work?
If a cat walks through contaminated dust, say from lead paint or contaminated soil, the lead particles get on their fur. Then, when they groom themselves, which cats do meticulously,
They ingest it.
exactly, something totally natural becomes a way they poison themselves.
That's really concerning. Okay, so given all these potential sources, what are the signs? What should pet owners be looking out for?
The signs generally fall into two main categories, gastrointestinal and neurological.
Okay, which usually comes first.
Often, the GI signs appear first, especially
Okay.
with more chronic low-level exposure, things like vomiting, maybe diarrhea, loss of appetite. Anorexia is the term vets use, abdominal pain, sometimes even regurgitation because the esophagus can become enlarged and weak, a condition called megasophagus.
So tummy troubles are often the initial clue.
Frequently, yes. The neurological signs can be more dramatic, though. They tend to be more common with sudden high exposure or in those younger animals we talked about.
And what do those look like? They sound scary.
It can be. You might see things like lethargy, just being really sluggish, or the opposite, unusual excitement, even hysteria. Seizures are a major concern. Blindness can occur.
Blindness, wow.
Yes. And in cats, the source specifically highlights central vestibular signs. That might look like their eyes darting up and down uncontrollably, vertical nystagmus, or being very unsteady on their feet, which is ataxia.
So specific things to watch for in cats too.
Definitely. And really importantly, context matters. If you know you live in an old house or you've been doing renovations or maybe you saw your pet chew on an old battery or something, telling your vet that history is absolutely crucial. It can really point them in the right direction.
That makes total sense. History plus signs. But how do vets confirm it? Rule out other things?
Good question. Diagnosis isn't always straightforward because the signs can mimic other diseases.
Like what?
Well, in dogs, a vet might need to rule out things like canine distemper virus, other brain infections, epilepsy, maybe poisoning from something else. Even heat stroke can cause neurological signs.
Oh, no.
In cats, differentials might include certain degenerative diseases, metabolic problems like hepatic encephalopathy, where liver issues affect the brain, or again, other types of toxins.
So ruling things out is step one, then what? Lab tests.
Yes, lab work provides important clues. A complete blood count, or CBC, a biochemistry panel, and a urinalysis.
What might they show?
On the CBC, remember those immature red blood cells we talked about? Seeing an increased number of those, specifically nucleated red blood cells, maybe 5 to 40 per 100 white blood cells, can be a flag, even if the pet isn't severely anemic.
Okay, that's specific.
Yeah, though not finding them doesn't rule lead out. You might also see changes in red blood cell size, shape, maybe some of that basophilic stippling, although it can be hard to spot sometimes. Maybe a high white blood cell count, particularly neutrophils.
And the chemistry or urine tests?
In cats, elevated liver enzymes like AST and ALP have been seen. The urinalysis might show subtle signs of kidney damage, like glucose in the urine when blood sugar is normal, or maybe some hemoglobin.
So these tests build the picture, but they aren't definitive proof on their own.
Exactly. They're supportive evidence. The most direct confirmation comes from measuring lead levels directly.
Right, the blood lead level you mentioned earlier, above 0.4 ppm.
Yes. Measuring lead concentration in whole blood is key for diagnosis in a living animal. A level above 0.4 parts per million is generally considered toxic. After death, finding levels above 5 ppm in the liver or kidney is significant.
Okay.
But it's important to realize blood levels can fluctuate. They reflect recent exposure and how the body's handling it, but not necessarily the total amount of lead stored in the body, like in the bones. So the level doesn't always perfectly match how sick the animal seems.
That's a really important nuance. What's the normal level, usually?
Normal background levels are usually very low, typically less than 0.05 parts per million.
Got it. Is there any other way to test for lead burden?
There is a test called the CANA2-ETA mobilization test. It's a bit more involved.
How does that work?
You collect a urine sample, then give the pet an injection of a chelating agent that's CANA2-ETAA, and then collect urine again over a set period, usually 24 hours.
And what are you looking for?
In an animal with lead toxicosis, giving the EDTA pulls lead out of the tissues and into the urine. So you see a big jump. The source says maybe 10 to 60 times more lead in the urine collected after the EDTA compared to before.
That sounds pretty conclusive.
It can be very helpful, yes. The source also mentions another chelator, Succimer, might potentially be used for a similar test, but it hasn't been as thoroughly studied for that specific mobilization purpose.
Okay. What about imaging, like X-rays?
X-rays can sometimes be useful. If the pet swallowed something dense made of lead, like a fishing thinker or paint chips, it might show up as bright white shapes in the stomach or intestines.
Ah, because lead is dense.
Exactly, it's radiopaque. But finding something helps confirm exposure, but not finding anything doesn't rule lead poisoning out, especially if the exposure was from dust or contaminated water.
Makes sense. And I guess post-mortem findings can confirm it too.
Yes, if an animal unfortunately passes away, a pathologist might find actual lead objects or paint chips in the gut. Microscopically, they look for specific changes, like those intranuclear inclusion bodies, basically little protein clumps containing lead inside liver or kidney cells, and characteristic damage in the brain.
Okay, so diagnosis involves putting together history, signs, lab tests, lead levels, maybe imaging, a whole puzzle.
It really is.
All right, let's shift to treatment. If a pet is diagnosed, what can be done?
Treatment really needs to start quickly. Often it involves hospitalization, especially initially, for intensive care and the first rounds of gelation therapy, depending on how sick the pet is.
Gelation, that's the key treatment, right?
Absolutely central. But supportive care is also vital. Things like intravenous fluids, balanced electrolytes to correct dehydration and support the kidneys.
Makes sense. What if they just ate something with lead?
If it was very recent, the vet might try to remove it. Gastric lavage, basically washing out the stomach, might be an option. Or something called whole bowel irrigation, using solutions to flush the entire digestive tract.
Okay, get the source out if possible.
Exactly. And then managing the symptoms. If there's still lead in the gut, saline cathartics like sodium sulfate or magnesium sulfate can help move it through faster.
What about the neurological signs, the seizures?
Controlling seizures is critical. Medications like diazepam or phenobarbital are used for that. If there's evidence of brain swelling, cerebral edema, then drugs like mannitol or dexamethasone might be given to reduce that pressure.
Are there any other supportive meds?
The source mentions some potential supporting roles for antioxidants, things like vitamin C, vitamin E, alpha-lipoic acid, N-acetylcysteine, and also B vitamins, especially thiamine. The idea is they might help mitigate some of the cellular damage, but optimal doses aren't really established.
So more research needed there, but potentially helpful.
Potentially. But the absolute mainstay, the most crucial part, is chelation therapy.
Right. Tell us more about that. How does it work again?
Chelators are drugs that bind tightly to heavy metals, like lead in the bloodstream and tissues. Once bound, the lead chelator complex is more easily filtered by the kidneys and excreted in the urine, effectively removing lead from the body.
Okay. And what are the main chelating drugs used?
The two main ones discussed in our source are CANA2-ETA, that's calcium disodium ethylenedium and tracetate, quite a mouthful, and Succimer, also known as DMSA.
Okay, CANA2-EDTA and Succimer, how are they used?
CANA2-EDTA is typically given by injection under the skin into the muscle, or sometimes IV. It's usually given multiple times a day, like every 6 hours, for maybe 2 to 5 days.
Right.
It needs to be diluted properly first, and often pets need multiple courses of treatment with rest periods of several days in between to allow lead stored deeper in tissues, like bone, to redistribute into the blood where the chelator can grab it.
Are there downsides to CANA2-EDTA?
Yes, there are considerations. It's generally contraindicated, meaning shouldn't be used in animals with severe kidney impairment or who aren't producing urine, because that's how the lead gets excreted. It also should not be given by mouth. And there are precautions for use during pregnancy. Long-term use could potentially deplete essential minerals like zinc.
Okay, important points. What about the other one, Succimer?
Succimer has some significant advantages. A big one is that it can be given orally as capsules or a suspension.
Oh, so potentially outpatient treatment.
In some less severe cases, yes, which is a huge benefit for pets and owners. Also, importantly, Succimer doesn't seem to increase lead absorption from the gut if there's still lead present there, unlike oral EDTA could.
That's good.
It's also reported not to be toxic to the kidneys, and it has less effect on chelating essential minerals like zinc compared to EDTA. The source specifically mentions it's been used successfully to treat lead poisoning in cats, too.
Sounds like a good option. How is it typically given?
The usual protocol is something like giving it every 8 hours for 5 days, then maybe reducing to every 12 hours for another 2 weeks or so. Again, rest periods between cycles might be needed depending on blood lead levels. And if the pet is vomiting, it can sometimes even be given rectally.
Versatile. Is surgery ever needed?
Yes, if an X-ray shows a solid lead object, like a sinker or battery fragment, stuck in the stomach or intestines, surgical removal might be the best or necessary course of action. You need to get the source out.
Makes sense. This is all quite complex treatment. What's the most critical message for pet owners going through this?
Client education is absolutely paramount. Owners must understand that if their pet has lead poisoning, there can be lead hazards in the home environment that pose a risk to humans too, especially children.
That's a really vital point. The pet is like a sentinel?
Exactly. They should be strongly encouraged to notify their local public health department. And, critically, they need to work with their vet and possibly environmental health experts to identify the source of the lead and remove it completely. Otherwise, the poisoning can just happen again.
Absolutely crucial to break the cycle. What about follow-up after treatment? How do you know it worked?
Monitoring is key. Blood lead levels should be rechecked after finishing a course of chelation. The goal is usually to get the level down below 0.1 parts per million. This recheck is typically done maybe 10 to 14 days after stopping the medication to see if levels rebound as lead leaches out from bone stores.
Okay, so follow-up testing is needed. And prevention. How can people avoid this altogether?
Prevention really hinges on awareness and action. If you live in an older home or suspect lead might be present, seriously consider testing. You can test paint chips, dust samples, even soil in the yard before letting pets have access, especially unsupervised access.
Proactive testing.
Yes. And if lead is found, you need to take steps for safe removal or containment abatement to eliminate the source from the pet's environment.
Yeah.
That's the ultimate prevention.
Right. So, bringing it all together, what's the general outlook? If a pet gets diagnosed and treated, how do they usually do?
Generally, the prognosis is actually pretty favorable if it's caught reasonably early and treated appropriately with chelation and supportive care.
That's good news.
You should see significant improvement in the clinical signs, usually within the first 24 to 48 hours of starting chelation.
That quickly.
Often, yes, especially the GI signs. However, the prognosis becomes more guarded, more uncertain, if the pet has severe, uncontrolled seizures. That indicates significant brain involvement.
Okay.
And it's also important for owners to know that even with successful treatment, some animals, especially those with severe or very prolonged exposure before diagnosis, might have permanent residual effects, like lasting neurological deficits. Blindness, for instance, can sometimes be permanent.
So timely treatment is really critical for the best outcome.
Absolutely. Early detection, prompt treatment, and removing the source are the keys.
Okay, so the big takeaway seems to be lead poisoning, while serious, is often treatable, especially if caught early. Awareness of the sources, particularly, in older homes or environments, is vital. And getting veterinary help fast if you suspect anything is just non-negotiable.
Precisely. It underscores how things we might not even think about in our daily environment can pose real hidden threats to our pets.
It really does.
Yeah.
And that brings us to a final thought for you, the listener. Knowing that these kinds of hidden dangers, like lead, can exist even in familiar surroundings, what small, proactive steps might you consider taking in your own home or environment just to double-check and ensure the continued safety and well-being of your animal companions? Something to mull over.